These have been the 4 most difficult years in Syrians' lives. They have lost loved ones, their livelihood, and access to the most basic needs of daily life. It's almost more than they can bear, but they do it, day in and day out, with such resilience.
Since the conflict in Syria began in 2011, Syria Relief and Development has stood by the Syrian people, providing care for women, children, the sick and injured, displaced families, and anyone in need of aid. We've helped more than 500,000 Syrians and provided more than $24 million in humanitarian aid. SRD has addressed the country's most urgent needs of food and essential non-food items, rehabilitation and physical therapy, reproductive care for women, psychosocial support for children, advanced medical care for the injured, and so much more. SRD's programs have provided a variety of services for Syrians in need. Care packages filled with pantry staples and seasonal non-food items have brought relief to families. Physical therapy and rehabilitation services have helped the injured recover by providing mobility and functionality treatments, prosthetic limb fittings, dialysis, and treatment for burns and wounds. SRD's regional hospitals across Syria have provided advanced healthcare services every single day. Primary and reproductive health polyclinics have supported the hospitals by providing primary healthcare services and preventive follow-up care. The polyclinics have also provided reproductive health care for women that includes prenatal, natal, and postnatal care, labor and delivery, and family planning services. And through SRD's pediatric primary health and psychosocial support centers, children have received much-needed primary health care. They've also participated in activities that have encouraged dialogue and self-expression, helping vulnerable children better cope with the traumas of war. These centers have treated children like Noor, a little girl who developed nightmares, severe anxiety, and couldn't leave her shelter to attend school after a bomb struck her home. Noor worried constantly about losing her loved ones. SRD staff's counseling and support gave her the ability to cope with her painful feelings and allowed her to return to school. All of these programs and more are built on SRD's foundation of hope for a brighter future for Syria. In 2015, SRD introduced an advocacy platform to its programs, ensuring that as a diaspora organization, SRD serves as a voice box for the Syrian people.
We give them aid, help, and hope. Our advocacy efforts connect us to policymakers, which helps us deliver more effective humanitarian assistance.
The resilience of the Syrian people is reflected in SRD staff and beneficiaries who have persevered through major obstacles. In April 2014, SRD's hospital in Aleppo suffered a devastating loss when it was destroyed by barrel bombs during an attack on the city.
Our hospital in Aleppo was built brick by the community, and then it was destroyed. It was devastating, but our staff picked up and started over. Within a few weeks, they were treating patients at a new hospital. That's what you have to do. You have to build and you have to rebuild if necessary. The lives of people depend on it.
In return for SRD's hard work, the Syrian people have gifted the organization's staff, volunteers, and supporters with smiles and endless thanks for the hope and support they have received. SRD continues to renew its commitment every day to bettering the lives of Syrians in need, but only through the help and generosity of people like you.
We really appreciate our donors. It's you who are the hearts of SRD. Your support had made it possible for so many Syrians to be helped, and it will be a great relief for so many more who are waiting for our assistance. Thank you for great generosity and continuous support.